All right. Well, on behalf of the AANEM, we want to thank everybody for joining us tonight for the first Neuromuscular Fellowship Fair. The purpose of the fair, just so everybody is aware, is to give residents an opportunity to hear firsthand from each of the programs what about your institution and what your fellowship does entail. So once you are all done with your presentations, then we will open it up for question and answer. So residents, you're welcome to put in any questions throughout the presentations. Just know that we won't answer anything until the very end. So tonight we have 4 programs. So we have the University of Colorado, we have University of Utah, Barrow Neurological Institute at St. Joseph's Hospital and Medical Center, and then Boston University Medical Center. So we will just have each program give their presentation. And like I said, when we're done with that, we will jump into question and answer. So I will kind of come on again before we jump into that next session. So I guess sit back, relax, and we'll go ahead and get started. So we will go ahead and let Dr. Kwan take it away for University of Colorado.
So thank you for attending and welcome to our presentation about the University of Colorado. Our neuromuscular fellowship is the only neuromuscular fellowship in the state of Colorado, and we are located at the Anschutz Medical Campus, which is in Aurora, Colorado. So it is also the home of the University of Colorado School of Medicine. So there may be some confusion because different things that you'll see on the internet indicate that we're the University of Colorado Denver, but we're actually in Aurora. So Aurora is the easternmost suburb of Denver, and Denver is actually just kind of one large metropolitan sprawl at this point. And so even though we are in Aurora, technically speaking, this is really just part of the larger Denver metropolitan area. So hopefully that's not too confusing for people. So just a few things about our program. We are the oldest fellowship program in the Department of Neurology. We've been training fellows for 45 plus years, not me personally, but our program. And we have been ACGME accredited since 2008, which is when the certification began. I've been program director since that time. And we have one position, it's 1 year long. Our fellows spend primarily most of their time at the University of Colorado Hospital, and they spend 1 half day every other week at Children's Hospital, Colorado. So we have many hospitals in Denver and in the region where our graduate medical education trainees go, but our fellows are really just at these 2 sites. And so, as I mentioned, I'm the program director, Diana Kwan, and Michelle Bielkowski is our program coordinator. Our catchment area is pretty large because we're the major quaternary care center in this region, and we get patients from southern Wyoming, western Kansas and Nebraska, and northern New Mexico, and then of course the entire state of Colorado. And when you look at the way the highways are arranged, you can kind of see why that is, because everything kind of funnels into the Denver metropolitan area. So we have lots of patients and a very wide variety of neuromuscular pathology. We have 7 full-time faculty members, and I've shown everyone here, which unfortunately you can't meet them in person since we're doing it this way, but Matt Wickland is our section chief, and Matt is primarily interested in both acquired and hereditary muscle disease. He's been with us for about 3.5 to 4 years. I'm the program director. I run the EMG lab, and I've been here for about 20 years. Our associate professor in the department is Vera Fridman. She is interested in hereditary neuropathy, primarily CMT and diabetic neuropathy. We have 3 junior faculty members, Dr. Stacy Dixon, Dr. Laura Foster and Dr. Tom Regol, and their interests are in SMA for Dr. Dixon. She has also worked very closely with me on my research projects in transthyretin amyloidosis. Dr. Foster is very interested in ALS, and she's also trained in palliative medicine. So she has taken on a very large role in running our ALS clinic. And our newest faculty member is Dr. Tom Regol, who has an interest in inpatient neuromuscular medicine and is also interested in myasthenia gravis. Our last faculty member is Deborah O'Reilly. So Deborah has been with us for about 10 years, and she is our neuromuscular physician assistant. So she's been extremely instrumental in helping our fellows kind of learn the ropes and also taking care of our very complex neuromuscular patients. And we are in the process of hiring additional APP staff. In the middle, I've got two pictures of our current fellow, Amanda Kennedy, who is on the call this evening and will be available to answer any questions. And then Monica Petrulu is going to be our fellow next year. And both of these folks are graduates of our own residency program. Our facilities are, as I mentioned, the University of Colorado Hospital, which is pictured here on the left. We have a couple inpatient towers here, so we do a lot of inpatient EMGs, we do inpatient consults, and then our outpatient facility is over here, and that's where we have our clinic. And just to the east of that is Children's Hospital, which is here. And that's where they run the Children's MDA clinic, where our fellows learn to see kids. This is our typical weekly schedule for the fellows, and it's pretty much very similar every week. They spend a lot of time in the EMG lab. All of Monday is typically in the EMG lab. Tuesdays, we have time for them to do their own research, and also if they are working on quality improvement projects, it's time for self-study. So this is protected time. And also occasionally if we have an inpatient consult that's unscheduled, either a clinical consult or an electrodiagnostic consult, they'll use this time here. On Wednesdays, we typically will have a section meeting where we'll go over cases and talk about some administrative issues. Right after that, we do a multidisciplinary ALS meeting to talk about the upcoming patients for our MDA and ALS multidisciplinary clinics. And then immediately after those two meetings, the fellows will read muscle biopsies and nerve biopsies with Dr. Wickland. And then in the afternoon, they'll see patients in the outpatient clinic. Thursday is all outpatient MDA, ALS, multidisciplinary clinic. That's the day that we have all of our therapists and ancillary staff to support our patients. And then on Fridays, it's a little bit of a mixed bag. Most Friday mornings, the fellow is doing hands-on muscle biopsies. We do open biopsies here at the University of Colorado, and we do our own patients. And on days when there aren't biopsies, the fellow comes down to the EMG lab. And then in the afternoon, it's every other Friday afternoon at Children's Hospital in their MDA clinic, and then the alternate Fridays are in the EMG lab. So as far as didactic curriculum, we have a curated syllabus. We also have electronic modules that are topical, which the fellows kind of work through during the course of the year. We do our weekly case conferences, as I mentioned, and then every month we do a research conference where either the faculty will present what they're working on, the fellow will sometimes talk about their own research project, and we will also bring in guest speakers for these conferences as well. And then we have numerous grand rounds and dedicated named lectures and special lectures that are dedicated to neuromuscular topics. We have quite a bit of clinic volume, and the role of the fellow is kind of a little bit of a service role, but also we are very cognizant of the educational piece of it. So each patient is assigned plenty of time to spend with the fellow. Our new patients get 90 minutes and our follow-ups get 45 minutes, and that gives us adequate time for staffing and education for each case. The muscle biopsies are about 35 hands-on cases per year. We only do muscle biopsies ourselves. The nerve biopsies are done by the neurosurgeons, but the specimens are read in our lab. And you can see here that we read about 150 specimens a year. So most of what we see actually comes from outside providers. Yeah, with regard to EMGs, we do about 1,200 studies per year. And this is just in the neurology EMG lab, which is where our fellows spend their time. PM&R also has their own lab where they do probably an equal number of studies, but our population is enriched for neuromuscular disease. And so the fellows learn how to do routine testing as well as more esoteric things involving exercise testing, single fiber, some autonomic studies. And by the end of their time, they feel very confident in their ability to practice electrodiagnostic medicine, and they are eligible to sit for the boards. With regard to pediatric patients, that's about 3 to 4 patients per clinic each half day. And initially, they're kind of assigned by educational value and age. A lot of our fellows are not super comfortable with children, so they'll start them out with teenagers, and then as they get more knowledgeable and confident with kids, then they'll dial down the age ranges to younger children, toddlers, and infants. We have a very rich academic learning environment. We have numerous clinical trials that are currently ongoing. Right now we have 23 active trials, as well as quite a few that are in various phases of startup and negotiation. And they're in quite a variety of different areas within neuromuscular medicine. We have several trials in acquired and hereditary muscle disease. We're doing ALS trials. We have neuropathy trials, myasthenia gravis, and SMA. And so a good mix of different types of disorders. The faculty themselves are very active in the national conference circuit, and our fellows also will attend every year specific conferences that they are interested in. And as a group, we are involved in a myriad of consortia and networks. You can read the list for yourself. So we're pretty plugged into different things that are going on, both in research and clinical care for many different disorders in neuromuscular disease. We're very proud of our fellows, and I just kind of listed our most recent graduates and what they're doing. It's kind of a mix of academic and private practice. And as I mentioned, Amanda Kennedy is our current fellow, and she's kindly volunteered to take any offline questions as well. So I put her email address here, and you can feel free to reach out with any specific questions. And then finally, just a slide with some additional information and resources. The first is to a video that was put together by our GME office. It's a little more general, just some information about the area, our campus, and kind of some useful tips about living in Denver. And then the second link is to our section website, and third is to our publications in the last year. And then I put our emails here. So Michelle and me, you can feel free to reach out after the meeting if you have any additional questions. And with that, I will wind up with this lovely photo of somewhere in Colorado. It's a secret location, which I might tell you where it is if you come here. But more likely than not, if you do come here, you will find your own favorite places in our state. So with that, I'm going to go ahead and leave off and turn it over to the next speaker.
Great, wonderful. Well, I'm really pleased to be here. Grateful for this opportunity to talk to you guys about the University of Utah Neuromuscular Medicine Program. I'm Kelsey Burrell. I'm the program director. And here's a shot of our hospital with the mountains in the back. So this is kind of the overview. I'm from Portland, Oregon. And so before I came out to Salt Lake, I didn't really know what Salt Lake was made of. It was a bit of a surprise for me. And I've been pleasantly surprised. So it was a lot bigger than I thought. It's a small city, but it's unique in that it's the only tertiary neurologic center in the Intermountain West, depending on if you consider Denver in the Intermountain West, which is some people do, some people don't. So it has a very large catchment area, about 10% of the US landmass. With that comes a very wide patient diversity. So I've seen a lot of zebras through my residency and fellowship at the university, and also high volumes. So we're not competing with other, local centers for these interesting neuromuscular cases. We see all of it. It is a world-class institution. So it has a really, really nice amount of resources and growth, but it also is very friendly and collaborative, which is really what attracted me. People use first names a lot with their attendings and hang out after work, which was really important. There's a lot of research going on, but it's a place where you'd also meet a lot of people who probably have similar interests. It is a medium-sized city, so it has a lot of cultural comforts that from Portland I expected. So as a Broadway theater, great restaurants, active music scene. So this is Red Butte that has outdoor conferences or concerts where you can bring your own alcohol and picnic and listen to awesome music. And then of course, Sundance Film Festival up in Park City is a must-see as well. International Airport, 30 minutes from the ski hills, was also kind of a fun thing about the city. But most importantly, what about the program? So it is ACGME accredited, and we have 1 to 2 fellowship positions per year. It's been alternating most years. This year we have 1, and next year we're going to have 1 who's coming from PM&R. When I was a fellow, I had a co-fellow, and she was from PM&R. So we're very PM&R and neuro-friendly. It's usually a 1-year fellowship position, but we do offer 2 years with advanced planning. And we have advanced clinical training and really the full spectrum of the neuromuscular subspecialties. So what our campus looks like, we're divided between a few places. So the University of Utah, the lower right, is about a 590 bed hospital. And our outpatient clinic, where neuromuscular is mostly housed, is connected by a long bridge, and that's shown in the upper right here. We also share this building with a peripheral nerve lab, where we do all of our nerve biopsies and neurosurgery and imaging, and a lot of the research space is there. And then what's really been fun is we have a large cancer institution called the Huntsman Cancer Institute, where a lot of interesting cases come from. We're often consulted, and I actually just set up a neuromuscular oncology clinic for a half day every week. So we have a strong connection with all of our oncologists and hematologists. And then in the lower left is our new Craig Nelson rehab hospital as of spring 2020. So a lot of our patients also have been to rehab, and that's increasing also the need for EMGs. We have a lot of subspecialty clinics, and depending on your interests, we can really tailor that. So I was really interested in oncology and dysautonomias. And so I got to spend a lot of time with Melissa Cortez, who started an autonomic laboratory at the University of Utah, doing the full spectrum of tilt table testing and heart monitoring and such. So I got trained and now am able to read autonomic tests. One of my colleagues was really interested in spine. So she spent a lot of time doing sports medicine. She does all our muscle biopsies as well. We have a dedicated motor neuron disease clinic, a muscular dystrophy clinic. We spend a lot of time with rehab. We do a lot of pediatric electrodiagnosis. And then the neuromuscular oncology clinic is a brand new thing that we started, and hopefully it will be multidisciplinary next year if all goes well. We have spine clinics that are dedicated to neuromuscular patients, and then the autonomic lab, and then a few rural and remote clinics. This down below is in St. George, where we go twice, and that's a lot of fun for fellows to attend. And neuromuscular is quite a busy fellowship. I was actually surprised how busy it was. There's a lot of common and rare conditions that we'll see. And in the EMG lab, you'll get comfortable doing single fiber EMG, jitter analysis. We do a bunch of laryngeal EMG. And then one of my colleagues is very interested in extended exercise testing. And he takes all those patients because I just can't wrap my head around it. We have neuropathology, and so there's a lot of exposure both to interpreting cases as well as performing muscle biopsies. There is, if you're interested, training in autonomic lab testing. If that's not your shtick, we'll at least expose you for 3 sessions and let you decide after that if you want to do more. And then there's a lot of genetics, because Utah tends to be a community where there's a lot of family trees. Historically, there's a lot of genetic information that we're privy to, which is great. This lends itself to a wide variety and range of research opportunities, and there's strong mentorship. So a typical week, so the majority of your weeks would look like this. 2 months out of the year will be dedicated for physical medicine, rehab, and pediatrics. So you'll spend most of your time between those 2 clinics. But a typical week, usually we have a clinic, half day, neuromuscular disease clinic, followed by EMGs in the second half of the day, which is neat because a lot of the patients that you see in workup in the morning, you actually get to see what it ends up being or get a lot of information. So I really like that kind of clinical correlation that this allows. And that happens Monday, Tuesday, and Thursday. Wednesday, the morning, there's a lot of meetings. So we have grand rounds. Neuromuscular pathology occurs every other week. And then there'll be, if we have didactics, we have a monthly interesting case conference and journal club that would occur here, or reading and research time if we don't have a lot going on. In the afternoon of Wednesday, we have motor neuron disease clinic, and then a bit of research time as well. And Friday, we have muscular dystrophy clinic, which we do see a lot of kids in that clinic. So you do get pediatrics kind of regularly every week as well. In the afternoon, we have a few things that can happen: general continuity clinic or EMG clinic towards the latter half of the fellowship year, and then autonomic lab time as well, which is optional. This is our faculty. So Summer Gibson is our division chief. Her specialty is motor neuron disease and genetic epidemiology. I'm the fellowship program director. My interest is amyloidosis, both acquired and hereditary, as well as neuromuscular oncology. Kyle just joined us 2 years ago, and he's interested in neuromuscular junction diseases and does research in that area, as well as neuropathology. So he's studying for his boards for neuropath. Russ Butterfield is our pediatric neuromuscular specialist, and he does a ton of research in neurogenetics. Rob Singleton is my #1 ski buddy and mentor, and his focus has been peripheral neuropathy. We have a nurse practitioner, Cassie, who does general neuromuscular. Clark Moser was our fellow last year, and we got lucky and hired him, and he's really interested in periodic paralysis. He's the guy who's gotten really interested in extended exercise testing. Ligia Onofre, she's the EMG lab director, and she's also the program director or assistant program director for the neurology residency. And she's the spine guru, and she also does most of our muscle biopsies, which are punch biopsies, just bedside. Mark Bromberg's been with us forever. He wouldn't let me tell you his age, but his interest is motor neuron disease and neuromuscular junction. And then Melissa Cortez is the director of the autonomic lab, and her interests are autonomic neurology and MS, but she's also trained in the whole spectrum of neuromuscular diseases. We have a lot of research, a lot of active clinical trials in the following areas. So it really covers, I think, almost all of the neuromuscular subspecialties, from ALS to neuromuscular junction, a lot of the inherited myopathies, TTR amyloidosis, just generic small fiber and diabetic neuropathies, and then some others, inherited neuropathies, so CMT. One of our attendings is actually PI on a COVID-19 plasma trial randomly. So sometimes we jump out of neuromuscular. And then I wrote a note to myself, I didn't get all of Russ and Melissa's. That was not meant to be there. Here's our team about to do the ice bucket challenge. And then very active in national and international conferences and presenting. Many of our members have presented our fellows generally go to the muscle study group and the POTS and beyond if they're interested, and then usually AANEM. And one thing I want to emphasize is just the culture. It is a phenomenal educational experience, but also it should be a very fun year or two. So the neuromuscular team has really become my family. They threw me a baby shower that was amazing, and I've had a lot of meals with this group and gone on a lot of fun outdoor activities. And so here's some of the things that we like to do. This is Rob Singleton, my mentor, at a backcountry ski lodge making margaritas, snow garitas he calls it. And this is us climbing a local peak. And then this is, I probably shouldn't have put this here, my husband skiing with my son, my 2-year-old son, my firstborn. It was a very safe day, don't worry. This is a slot canyon in the southern desert. This is just like 10 miles from us, lower left. Some of the mountainscapes in the Wasatch that we like to hike in. And on our way down from that hike, we saw 2 moose. They're kind of resident moose. We see them every time we go on that hike. And then in the lower right was my co-fellow and our EMG technologist, our lead technologist. We have 2 techs, Candy Dolan, who's a mom to all of us. And with that, I'm not sure, I was supposed to set an alarm, but I forgot. So I think that's about 10 minutes. Sorry if it's over. Thank you so much for your time and your interest. Please email us with questions, and we have our site up on the AANEM website. Summer Gibson is the program director, and she's going to take all the emails while I'm on maternity leave. You can send them to me. I just might not get back to you very quickly. So there are emails, and we look forward to hearing from you. Thank you so much.
So my name is Eric Ortega. I'm with the neuromuscular faculty at the BNI, and I'm also the head of the neuromuscular medicine training program. And so we're based at St. Joseph's Hospital, so that we're a little enclave within that, that mixed BNI. So that's an image of the hospital in the lower left corner. It's a 586-bed hospital with a 64-bed neuro ICU, and we have also a busy transplant service. Transfers from all over Arizona, sometimes from other states as well. So we get to see a lot of acute neuromuscular disorders, as well as there's a lot of patients with critical neuromyopathy that we have the opportunity to see. With the center image, this is where the predominance of the neurology department exists. We're on the 4th floor. Our department's about 45 neurologists, and we have 7 residents per year. So a moderately busy center, not like some places, but we get to see a wide variety of patients. We also have time spent by the fellow at the Phoenix Children's Hospital, which you can see in the lower right image for their pediatric exposure. As for the residents at the fellowship itself, we could take up to 2 neuromuscular medicine fellows, and they typically do 1 year's time. Some people like to do 2 years. One of our recent graduates and people who joined our faculty actually did an extra year for ALS focus as well as clinical research. We've had I guess we're not as well storied as some other neuromuscular training departments, but we've had about 6 graduates and 3 have gone into academic practice, and 3 have gone into private practice. I've looked at other people's sort of tours that they provided, and they've often provided beautiful images of their center. So I thought I'd include what I think is like some lovely images of our center. We have we were able to use donations from some unfortunate people who developed ALS to help develop a center both for the clinical care of patients, but also for the development of the clinical research of patients with motor neuron disease. We have 3 EMG machines, NATIS machines, and we do roughly 1,200 EMGs per year. We do have an EMG tech, but we encourage or kind of require the fellow to do the nerve conduction studies on their own so that they become quite adept to it. We do a wide variety of different nerve conduction studies, cranial nerves, exercise tests, single fiber EMG, phrenic, diaphragmatic EMG, as well as the more typical studies. Things that we might not do that other centers will do is like laryngeal EMG. We don't have any clinical expertise in that. We also do have a neuromuscular ultrasound presence here as well. We have an 18 megahertz machine. I'm certified in neuromuscular ultrasound by the ABM, so that's a part of the training experience too, either in the setting of the EMG where it's most typically used, also we can do that at the bedside during clinic visits as well. We do have an autonomic lab, but I'm not directly related to that. We have a very spacious and clinic center where we're able to do procedures like skin biopsy, albeit we don't read the skin biopsies ourselves, we send those out. We do lumbar puncture, say for nusinerse injections too for the appropriate patient. We also do open muscle biopsies on the first floor of this building, which is an outpatient surgical center. We don't directly have responsibility for reading the muscle biopsy tissue ourselves, but we are closely aligned with the pathology department to go through that with them. If someone were to join us, they have their own little space as well, which they make their own and is theirs for as long as they choose to be with us. We also have a pretty strong research presence because of Dr. Scheffner, who I'll be speaking about a little bit. So in speaking with the research staff, at any one time, we have approximately 50 ongoing studies within neuromuscular subdivision within itself, and we have dedicated space and clinical staff for clinical research alone. We participate in consortium, including the Northeast ALS Association, as well as the NeuroNext. And so we have the predominance of research being ALS, but also myasthenia gravis, CIDP, distal symmetric polyneuropathy, GBS, and the like. We also have a increasingly strong basic science research with Dr. Rita Sattler from Johns Hopkins and Dr. Bob Bowser from Pittsburgh, who do C9orf and biomarker ALS studies respectively. Our faculty, the core faculty is predominantly of the left column, and so Dr. Jeremy Scheffner is the chairman of the department. He's stepping down from that position, but he's still be present for clinical research, and he's a great resource for that, both clinically as well. Dr. Mollet is the head of our subdivision, and his predominant focus is that of myasthenia gravis as well as CIDP. Dr. Lada is the director of the MDA clinic, and he is also the predominantly focused on motor neuron disease, but he also participates in the muscular dystrophy clinic. Dr. Jacobson, I mentioned earlier, he is a new hire, and he's predominantly focused on ALS, but he covers all other aspects of neuromuscular medicine. And I'm the one who predominantly might focus on primary myopathic disorders. Dr. Kara Knievel on the upper right, she was a prior graduate from our program, does some work with the Muscular Dystrophy Association Clinic, but she otherwise attends to other sort of clinical aspects of the overall neurology department. Dr. Burns is our pediatric neuromuscular specialist, and he primarily exists at Phoenix Children's Hospital. Everyone who's rotated with him has spoken very highly of him. And our current neuropathologist is Dr. Towari, who is based predominantly at Phoenix Children's Hospital, but he also spends time at St. Joseph's Medical Center. The basic structure of the for the neuromuscular fellow is as follows. So we have an ALS multidisciplinary clinic on Monday and Friday. On Tuesday, we have the only Muscular Dystrophy Association clinic in the Phoenix area, and there's only two in Arizona, with the other one being under Dr. Schur at the University of Arizona in Tucson. We also encourage that the neuromuscular fellow has a continuity clinic so that they could also more chronically manage people for their autoimmune neuromuscular disorders, as well as more directly participate in their care as compared to if they rotate through with one of us or the other. For the other aspects of the week, we do have them spend time with different physicians in block, so that way they could get different perspectives, different approaches to patients with neuromuscular disorders. This is not to say that every day of the week is slated towards any particular clinical activity. This is sort of just a base structure. There will be otherwise carved out time for education, research, and administrative duties. The predominance of the structure is following that schedule that I provided, but otherwise there could be separate time primarily focused on research. There's also separate time where people go to Phoenix Children's Hospital and work with Dr. Burns, and there could be separate elective time to continue to do focus on anything in particular that they would like to focus on. Chemogeneration is something that people do pursue here, but predominantly with the movement disorder clinic. Most neuromuscular medicine doctors here do it only for sialorrhea, but people have rotated with the movement disorder physicians and have had a great experience as part of that too. We have didactic lectures as well as a journal club. There's a neurology case conference that everyone attends, as well as a neuroscience grand rounds, and we have a neuropathology conference as well. Some people, I've reviewed some of the talks that people have given about their department, and they've included finances, and so I included as well. But so we pay people around $69,000 for the PGY for 5 years. There's $1,500 for educational material if you need to use it. If you're going to present anything at any of the conferences, the department will fund you for doing so. And if anyone develops a research project, there's a separate funding that could be applied for to help fund that project if you're interested in pursuing it. You know, everyone else just today has shown so far pretty pictures of snow-capped mountains, and that's something that can be seen in the Arizona, but not in the Phoenix area. So this is a picture I took earlier today, a bright, sunny, warm day of 73 degrees in Phoenix, Arizona, which is great for the winter, but of course it becomes quite hot during the summer, but we've all learned to coexist with it. And otherwise, the cost of living is great, the culture is improving, and there's always a lot of things to do. We have all the major sports field covered, and actually there's been articles I've read from international sources about the food scene out here out in Arizona. Of course, there's Sedona, Grand Canyon, the like too. Anyways, my email was on the start of the talk, so if you have any questions you'd like to send me, you could contact me or Lisa, who's also on this talk. All right, thank you for your time.
Hi, my name is Vincent Lau. Thank you so much, Sandra and the AANEM for hosting this and for having us. I'll try to keep it brief. I know that we're the very, very last program to go. So I'll be talking about the Boston University Neuromuscular Medicine program. So this is the first year, so we were recently approved by the ACGM, which we're excited about. We'll be having our first fellow enroll in July of 2022. So just a quick overview, our program is also 1 year as with most others. We're starting off with one fellow for this first year, and then kind of for each year. As you know, typical with other programs, we are offering training in clinical neuromuscular medicine as well as EMGs and neurodiagnostics. We also are going to be training our fellows in a variety of procedures, which I'll talk a little bit more about in detail. Our primary site, so the 99% probably of our fellows' time will be spent at BMC, which is our main hospital. There is going to be one monthly clinic that will be spent over at Boston Children's Hospital. And at the conclusion of our program, our fellows will be eligible to sit for the APP and board certification, as well as the ABEM examination. So just to go over some of our program highlights. So our division has 6 faculty members, and we have very kind of diverse expertise, and I'll go into them a little bit in the next couple of slides. We have a state-of-the-art electromyography laboratory. So in addition to doing the typical nerve conduction studies and REP-STIM, et cetera, we also do single fiber studies and collision studies and kind of some of the more interesting kind of things that you can do in an AMT lab. We have 3 rooms and we do at least 800 studies a year, and that was kind of our number during COVID, but typically we also do a little bit more than that. It is a little bit unique to our division that a lot of our faculty are trained in a lot of different procedures. So 3 of us are trained in Botox injections, and 5 of us do skin biopsies. We also have 1 specialist who does muscle and nerve biopsies, so our fellow will have a chance to rotate and observe and assist in those procedures, especially if that's something that they want to get intensive training in. Also, a little bit unique to our program is that Boston University has a multidisciplinary amyloidosis center, which is internationally renowned. So patients fly in kind of from all over the country and even all over the world to see us and to participate in our clinical trials. And so our fellow would be able to kind of rotate through the amyloidosis clinic as well. On most weeks, usually 1 clinic a week. And if they're interested in doing research with the amyloidosis center, then they're obviously welcome to. In terms of education, we have case conferences. So this includes a weekly waveform review, nerve and muscle biopsy, pathology review, which we actually go physically to do the pathology lab to look under microscopes together. We have weekly journal club discussions and also traditional didactics given by our faculty. I'll talk a little bit more about that in the next slide, but we do have a lot of robust research opportunities. And again, our faculty really have very diverse interests. And for example, me and Dr. Kaku, who's another faculty member, we're both involved in the amyloidosis clinical trial. So again, there's just a lot of opportunity for mentorship and scholarly work. And built into our schedules a weekly protect academic time. And a couple of other kind of logistical things. So our fellow would have paid registration to the Boston University internal conference. So we hold this conference kind of once a year, and it's been going on for a couple of decades now, actually, where our faculty lectures to people, visitors from all over the country. It's a 3-day conference, and people kind of fly from all over the states to participate in this conference. So the fellow would have access to that. In addition, we would pay for the AANEM membership fee and also a book fund that some of the other presenters have discussed. This is just a sample schedule. So as you can see, a lot of the sessions are spent about 4 a week on EMGs. And then in terms of the clinic, there's a couple here. There's a neuromuscular clinic, but also a clinic where we'll be training predominantly in procedures. So a lot of Botox injections and skin biopsies. And then on the Tuesday afternoon, as you can see there where it says amyloid or children. So that's where once a month, our fellow would rotate at Boston Children's Hospital for their MDA clinic. And then when they're not there, then they'll probably be spending time with us at the amyloidosis center. Also built into the schedule is a 1 session a week where we have our education. So that's where we're going to be doing those case conferences and waveform conferences and journal clubs we had talked about, or self-study for the fellow. And then also, in addition to that, a half day a week to do research and to pursue scholarship. This is the 6 faculty who are at the primary site at BMC. I'll just kind of briefly go over some of our people just because I think we're a little bit unique in that we are very invested in education. So we hold a number of different roles in addition to what we do for the fellowship. So myself, I'm the fellowship program director. I'm also the associate program director for the residency program. So we do have a long history of kind of very passionate clinician educators. I'm interested in neuropathy. I do, again, a lot of procedures, including Botox injections and skin biopsies. On the upper right is Dr. Shah, who's our neuromuscular division chief, and he's been here for about a decade. He's very passionate about the myelin neuropathy. He's going to publish extensively on this and other topics. He's kind of a master EMGer, and he's also an expert in nerve ultrasound. Lan Zhao, so she's the vice chair of research in the neurology department. So she's just very well published and an excellent mentor in terms of just all things to do with research. Her passions are myopathy, small fiber neuropathy, muscle and nerve biopsy. She recently published a textbook on the topic, which has been kind of very well received in the market. Dr. Michelle Kaku, who again, just kind of that theme of clinician educator. She's a residency program director, and her interests are in amyloidosis, myasthenia gravis, Botox injections. And bottom left here, Errol Marks, who's on this call as well. So he's one of our newer faculty, but he's also extremely passionate about medical education, has done already a lot of work with our residents. His interests are in functional neurological disorders and disparities in care. And then Connie Tang, her interests are in intersection of neuromuscular medicine and general neurology and systemic diseases. So, in addition to us really branding as clinician educators, I think we're also a very close-knit group. And I think, that's a very important kind of wherever you decide to train that you want to go kind of be welcomed into a family. And we definitely have that, that very cohesive kind of culture within our division. These are just a couple of pictures of the Amyloidosis Center. So we do think that this is kind of a gem at BU. It gives our faculty and our future fellow a chance to interact with people from other departments in cardiology and renal and in hematology to really kind of be a really excellent neuromuscular specialist who can kind of work with other departments. And this was the course I talked about. Kind of we've been holding this course once a year, and people kind of fly from all over the country to join us for this 3-day course. So we will continue to host this, and the fellow would probably take part actually in kind of planning and perhaps even teaching in this conference. I did want to have a little bit about life in Boston. I've lived in many different places. I was in New York for medical school, in Connecticut for residency, and I've kind of chosen to live in Boston because it's just such a kind of beautiful and historically rich city. So these are some of the pictures of our parks and of our landscape. I also really appreciate about Boston and that it's kind of central to a lot of states. I think someone had mentioned earlier today about kind of being in the middle of close to New Hampshire if you want to go away for a weekend, or Vermont, and then or go to Rhode Island south of us, or to the Cape, and there's a couple of hours drive to New York to the west. So it's just really kind of central to kind of whatever you might need. So just quick on the logistics of application requirements. So we accept applicants who have completed or are completing a neurology residency program, and they must be eligible for medical licensure in Massachusetts. The application is kind of similar to what others have described. So you could email me your CV, a one-page letter of interest, your step scores, and the 3 letters of recommendation. We are kind of participating in the more delayed application review process that was agreed upon by a number of programs. So we will be reviewing our application starting on March 1st, and then conduct our interviews over the spring. And our interviews will be held virtually. And so that's kind of it. I just want to highlight kind of one more time the unique aspects of our program, that in addition to kind of what you expect for a typical program, but we also are kind of fairly procedure heavy and really have a very strong culture of kind of clinician education. So I'm excited to be hearing from you. Thank you so much.
All right. Well, thank you so much for all the information programs. We appreciate your time. So we will move into the question and answer period. So please utilize the chat feature for that. You're welcome to ask questions to either a program, individual, to any of the fellows that are on the call. I'm sure they're happy to give you kind of some input from their firsthand experiences. As we're waiting for some questions to come in, we have been asking at the AANEM, but asking from the program directors or current fellows, if any of you would like to share with us what drew you to neuromuscular medicine. Why would you do neuromuscular as opposed to some other subspecialty?
I think the reason I chose neuromuscular medicine may be a little bit different than why I kind of have continued to love it. But I think what I appreciate most about it these days is that I'm a few years out of fellowship now, but I think every day is different for me, which is the way I've kind of tailored my own schedule. So there's just so many things you can do with the background and training in neuromuscular medicine. So, typically for me on Monday or Tuesday, I see patients in the Amyloidosis Center, and I do some teaching on Tuesdays. On Wednesdays, I see patients in a neuromuscular clinic. And then I spend some time with residents and teaching residents in neuromuscular medicine, general neurology. And on Thursdays, I do procedures mostly, so a lot of Botox and skin biopsies. And then Friday's my entire EMG day. So I just get kind of, get to engage with different part of my brain every day. And even like by the hour, I feel like I'm doing something different. And, with somebody who has a touch of ADHD, I think I really have appreciated that as part of my career. So that's kind of what I've really kind of still continue to appreciate about kind of going to work every week.
Yeah, I agree with Vincent, our Dr. Lau. that there's a diversity of the patients that's really special and what you can do in it. I actually chose it when I was a resident because I thought I wanted to do general neurology, and I thought it was something that could apply to so many different practices, whether I'm a smaller town. It's a nice skill set to have. And it's one of the specialties in neurology that I think really the exam matters the most. And I really liked that it had a procedural component to it. And I'm obviously not in an outpatient general or private general practice anymore, but I've noticed that the diversity of patients, we have young people with really treatable conditions. We have really complex conditions that are enigmas. And then we have older people at the end of their life with kind of end of the life issues. And I think that's pretty special that we can really, and some people change the course and other people, hold their hand and help kind of be there for them. So those are a few things that both drew me to it, but then kind of surprises along the way.
Yeah, I agree. I think the variety, the wide age range of the patient population, those are all just really wonderful things. Like every day is really different. It's not like you're prescribing the exact same medications to everybody who comes in. And I think one other feature that I found really great was the electrodiagnostic aspect of it, and just the ability to walk into the room and kind of solve the problem with your electrodiagnostic exam. And for someone who was always a little bit phobic of electricity and feeling like uncomfortable and not understanding it, the fellowship was a way to kind of conquer that phobia a little bit, and become facile with examining those patients.
For myself, I was thinking about epilepsy beforehand, but because I did some research on the like, and to me, after I got exposed to neuromuscular disorders, I felt like epilepsy was a little bit algorithmic as to their approach, and the fact that you had, like, every patient was unique and special, and was in some ways like a puzzle that could be solved with the integration of the examination, the history, and the vast different etiologies you would have to potentially consider for the individual patient. And then you get to do EMG, which is a dynamic test. You have to be thinking about what's going on, the anatomy, the physiology, putting it all together, I thought was great too. The fact that you also get to do biopsies, that's at times very important to help solve the patient. And then you potentially could make some people who've been having a horrible time in their life much better. Sometimes that's not true. So it's the sort of like the richer diagnostic approach to the patient, and I think, and the things that you could sometimes do to great benefit of the patient, I think was the thing that attracted me to neuromuscular medicine.
All right, thank you so much. Looks like we don't have any questions. So are there any fellows on the call that would like to kind of get their personal experience of the program?
I'm the current fellow at the University of Colorado. I work with Dr. Kwan, and I think one thing that, so I did my residency here, so I was fortunately already kind of familiar with the neuromuscular department and how the fellowship would work when I decided to continue and stay here for that after residency. But similar to how what other people have said, one thing that drew me to the fellowship is getting to be involved at each part of the diagnostic process. So from seeing the patient in clinic and then getting to do their EMG, actually performing their muscle biopsy, and then looking at the pathology the following week. It's a really unique thing that you don't get to do in many areas of medicine. And something that I think has been extremely valuable. And it's a really supportive group of people here. Colorado is a wonderful place to live. And so if you have any questions, feel free to send me an email or speak up now.
Thank you. Anybody else out there? There we go, Dr. Marks.
I guess I can speak in lieu of our fellows, since you will be the first of our fellows, but I did do my residency at Boston Medical Center. Vincent was one of my mentors and one of the reasons why I decided to go into neuromuscular medicine. And I couldn't be happier about that decision, and I'm back as faculty. The program that we already have is really just so focused on education and on your education, right? And right now, there's sort of a hole because there is no fellow, but we have so many residents who were involved with teaching and who are expressing interest in neuromuscular medicine, and just that culture of education and wanting other people to understand what's going on with our patients is something that's really unique to hear, and I think that something that our fellows will leave is that passion for education. They'll leave with that passion of education, and they'll leave as an educator. And as a neuromuscular doctor, I think you're viewed by other neurologists in many ways as like the neurologist's neurologist, right? You have the best exam in the hospital. You have tools that other people don't have, and when other people don't know what's going on, they ask you for help. And so so that's something that I already appreciate, and something that will only grow as our fellowship does.
Thank you. All right, well, we are running low on time. I did want to ask one question that we've had throughout, just in case there's others that will be watching this later that may have that question as well. Do any of the programs accept PM&R residency applicants?
Yeah, we do. So our incoming fellow this summer is PM&R, and then my co-fellow is PM&R. So we definitely are very PM&R friendly and like the collaboration, and work with PM&R a lot. We help train them in EMGs as well.
We would definitely consider a PM&R candidate who was qualified. And so because our program is based in neurology, most of our prior trainees have all come from neurology, but I think with the appropriate person, we would definitely consider a PM&R candidate.
We would invite PM&R candidates as well.
We'd be open to it. No physiatry residents ever applied, but we would always be open to that possibility.
Wonderful. I don't want to keep you guys too much longer, so we'll go ahead and kind of wrap this up. First and foremost, thank you so much for participating tonight. I appreciate the time you guys have given us tonight. We do know how busy your schedules are. It's really fantastic that you were able to take time to join us and to present to the residents. I know they appreciated hearing firsthand from you. We also want to remind everybody that these videos, all of the sessions, have been out there on the website. We have recorded everything. Tonight's session will go out probably within about 24 hours, but please feel free to go back and review the information. All of the program directors there have given you their contact information, so please feel free to reach out to them. Ask them any questions that you maybe have come up with since we had this session. Also welcome to utilize the portal. There is a communication feature there, so by all means, you're definitely welcome to utilize that as well. So before we close out, wanted to go through a couple of the upcoming events here at AANEM. So recently, we've been sending out advertisements for the spring virtual conference. So for any of you residents and fellows, please note that you do get to attend that for free. So please take advantage of that opportunity, go online, register. Your fee will be waived. So even though you have to still register, you will not have to pay anything. So it's a wonderful opportunity. So also for residents, fellows, anybody taking the neuromuscular and EDX exam, that is going on May 3rd through the 10th. Registration is open, so please contact your program coordinator if you'd like to get registered for that. And then we're all going to go see Dr. Kwan in Aurora, Colorado in October 13th through the 16th for the AANEM annual meeting. We're hoping this pandemic will be done and we'll be able to get back to seeing everybody in person again. So again, Thank you so very much, everybody. I appreciate your time tonight. I hope you found this helpful. Good luck to the programs and the residents. I hope you all find perfect matches. So with that, thank you so much and have a wonderful night.